Seniors, I am Dr. Alveric Stonem, and before you scroll past this, I need you to stop for just one moment, because what I am about to share with you today is something that I genuinely wish more doctors were talking about openly with their patients over 60. If you have ever woken up in the middle of the night with that uncomfortable, crawling feeling in your legs that just will not quit, if your hands feel like ice even when you are sitting in a warm room, if your ankles look puffy by the end of the day and you have just accepted that as normal, please do not ignore those signs. Your body is trying to tell you something important, and today I am going to help you understand exactly what it is saying and what you can do about it naturally. I have spent a significant portion of my career working specifically with older adults, and I can tell you from that experience that the symptoms I just described are not random. They are not simply the unavoidable price of getting older, even though that is what many people are told. Cold hands, tingling feet, swollen ankles, leg pain when you walk, these are signs of something that is happening inside your blood vessels. And when that something is left unaddressed, the consequences can become very serious very quickly. We are talking about blood clots. We are talking about stroke. In the most severe cases, we are talking about amputation. I do not say that to frighten you. I say it because you deserve the truth and because there is something genuinely powerful you can do about it starting today. Before I get into the solution, I want to quickly ask you something. If you are watching this right now and you recognize any of the symptoms I just mentioned in yourself, go ahead and type A1 in the comments below. If you are here because you want to protect your circulation before problems develop, type the number 0. I love hearing from people who are watching, and knowing where you are coming from helps me understand what information matters most to you. Also, take a second and let me know what city or country you are joining from today. It is always wonderful to know that people from all over the world are taking their health seriously enough to seek out this kind of information. Now let me tell you a little about myself so that you understand why I feel so strongly about this topic. I am Dr. Alveric Stonem, and over the years I have helped a remarkable number of seniors improve their health through natural approaches that work with the body rather than simply masking symptoms. I have seen patients come to me on multiple medications for circulation problems who were still suffering, still cold, still swollen, still in pain. And what I found, again and again, was that there were root causes being overlooked, causes that no prescription was addressing. When we addressed those root causes, things began to change in ways that genuinely moved me. People who had not felt warmth in their hands for years began to feel it again. People who struggled to walk a block without leg pain found themselves moving more freely. That is what is possible when you actually address what is driving the problem. So let us talk about what poor circulation actually looks and feels like, because I find that many people have one or two of these symptoms and do not realize they are connected. The first and most common sign I hear about is cold hands and feet. Not just occasionally cool, but genuinely ice cold, even when the rest of your body feels warm, even when you are bundled up, even when it is the middle of summer. This happens because blood is not reaching your extremities the way it should. Your body is prioritizing blood flow to your vital organs, and your hands and feet are getting what is left over, which, in cases of poor circulation, is not nearly enough. The second symptom is tingling and numbness, that pins and needles sensation that most people associate with a limb falling asleep. When it happens occasionally after sitting in an awkward position, that is normal. But when it is constant, when it happens in your hands while you are just sitting quietly, or in your feet while you are lying in bed at night, that is your nerves sending an alarm. Nerves require a steady, rich supply of oxygen-carrying blood to function properly. When circulation is poor, that supply is interrupted, and the nerves respond with that uncomfortable tingling sensation. Over time, if circulation does not improve, that tingling can progress to actual numbness, which is even more concerning because it means the nerves are receiving so little oxygen that they are beginning to shut down their signaling. The third sign is swelling, particularly in the ankles and sometimes in the hands. This swelling has a medical name, edema, and it occurs when fluid leaks out of the blood vessels into the surrounding tissues because the blood is not moving efficiently enough to carry that fluid back toward the heart. Many seniors notice that their ankles look puffy by the evening or that their rings feel tight by the end of the day. This is the body showing you, in a very visible way, that the circulation is struggling. The fourth symptom is one that many people experience but do not always connect to circulation, and that is leg pain or cramping during walking. You start walking, maybe to the mailbox or across a parking lot, and after a short distance, your calves begin to ache or cramp painfully, forcing you to stop and rest. This is called claudication, and it happens when the muscles in your legs are working but not receiving enough oxygen-rich blood to fuel that work. The muscle essentially goes into a kind of oxygen debt, and the cramping is the result. When the symptoms are this noticeable during activity, it is a clear sign that the underlying circulation issue has been developing for some time. Two more symptoms that often surprise people are hair thinning and brittle nails. Most people think of hair loss as a hormonal issue or a genetic one, and sometimes it is. But poor circulation is also a significant contributing factor. Your hair follicles and nail beds require a robust blood supply to grow and remain healthy. When circulation is diminished, these areas receive less nourishment, and the result is hair that thins noticeably and nails that become fragile and break easily. And finally, restless leg syndrome, that deeply uncomfortable, almost impossible to describe urge to move your legs that tends to strike in the evening or at night when you are trying to rest. Research consistently links this condition to poor circulation, and it is far more common in adults over 60 than most people realize. So now the important question is why? Why does circulation become such a significant problem after the age of 60, even in people who have taken reasonably good care of themselves? There are three root causes that I return to again and again in my practice, and understanding them is the key to understanding why the solution I am about to describe works as well as it does. The first root cause is a deficiency in something called nitric oxide. If you have never heard of nitric oxide, I want you to pay close attention here because this is one of the most important compounds in your body when it comes to circulation. Nitric oxide is a molecule that your blood vessel walls produce naturally, and its primary job is to signal those vessels to relax and open wider. When your vessels are relaxed and open, blood flows through them freely and efficiently, reaching every corner of your body, including your hands and feet. The problem is that after the age of 60, research shows that the body's natural nitric oxide production drops by approximately 50%, half. That is an enormous reduction, and it is a primary reason why circulation deteriorates so significantly in older adults. Less nitric oxide means stiffer, narrower blood vessels, and stiffer, narrower vessels mean significantly reduced blood flow everywhere. The second root cause is thyroid dysfunction. Conditions like hypothyroidism and an autoimmune condition called Hashimoto's disease are remarkably common in older adults, and they are especially prevalent in women over 60. The thyroid gland regulates your metabolism, and when it is underperforming, everything slows down, including your circulation. The heart beats a little more sluggishly, the blood moves a little more slowly. The warmth that should reach your extremities gets lost along the way. Many people with undiagnosed or poorly managed thyroid conditions experience circulation symptoms and never connect the two. If you have the symptoms I described and have not had your thyroid checked recently, that is something worth discussing with your doctor. The third root cause is chronic inflammation. Inflammation is a word that gets used a lot, but what it actually means in the context of circulation is this. When the body is in a state of chronic, low-grade inflammation, the blood itself becomes thicker and more prone to clotting. The walls of the arteries become stiffer and rougher. Plaques form more easily. All of this makes it dramatically harder for blood to flow freely, particularly to the smaller vessels that supply the hands and feet. Chronic inflammation can be driven by diet, by stress, by poor sleep, by existing health conditions, and by a combination of all of these things. And it is extraordinarily common in adults over 60. Now, here is where everything I have described comes together. Because I want to tell you about a natural drink that I have been recommending to my patients for a number of years, one that directly addresses all three of these root causes simultaneously. It targets nitric oxide deficiency, it fights chronic inflammation, and it supports the vascular system in ways that prescription medications often simply cannot match. I want to walk you through each ingredient individually so that you understand not just what to put in this drink, but why each component is there and what it is actually doing inside your body. The first and most foundational ingredient is beetroot. Beetroot is, in my opinion, one of the most underappreciated vegetables available to us, and it is the heart of this recipe for a very specific reason. Beets are extraordinarily rich in natural nitrates. When you consume those nitrates, your body converts them through a specific biological process into nitric oxide, the very molecule that relaxes and opens blood vessels. This is not a vague or theoretical benefit. There is solid peer-reviewed research showing that beetroot consumption meaningfully raises nitric oxide levels and improves blood vessel dilation in older adults. For someone whose natural nitric oxide production has declined by 50%, adding beets to the daily routine is like giving your blood vessels a direct signal to open up and let the blood through. You can use half a cup of fresh beetroot juice or chopped raw beets in this recipe. Both work effectively. The second ingredient is ginger. Fresh ginger root has been used medicinally for thousands of years, and modern research has given us a much clearer picture of why it works so well. Ginger contains active compounds called gingerols, which are among the most potent natural anti-inflammatory substances we know of. Remember that chronic inflammation is one of the 3 root causes of poor circulation that I described. Ginger goes directly after that cause, reducing the inflammatory signals that thicken the blood and stiffen the arteries. But ginger does something else as well that is particularly relevant here. It has a warming effect on the body from the inside out, improving peripheral blood flow and helping to restore that warmth to hands and feet that so many seniors have been missing for years. 1 teaspoon of freshly grated ginger is the right amount for this drink. The third ingredient is pomegranate, and this one genuinely excites me from a scientific standpoint. Pomegranate is packed with a class of compounds called polyphenols, including one specifically called ellagic acid. Research has shown that pomegranate not only contains antioxidants that protect the arterial walls from damage, but it also actively boosts the body's own production of nitric oxide. So you are getting a double benefit here. You are protecting the vessels from further damage while simultaneously increasing the signal that tells those vessels to relax and open. 1 tablespoon of pomegranate juice or fresh pomegranate seeds added to the blend provides this benefit beautifully. The fourth ingredient is turmeric, specifically its active compound curcumin. Curcumin is one of the most extensively studied natural anti-inflammatory compounds in the world. The research on it is vast and consistent. It reduces inflammatory markers throughout the body. It supports healthy blood flow, and it has been shown to reduce the tendency of blood to clot unnecessarily. For seniors who are concerned about blood clot risk, which is a very legitimate concern given how serious clots can be, the anti-clotting properties of curcumin are particularly valuable. Half a teaspoon of turmeric powder blended into this drink incorporates enough curcumin to make a meaningful contribution to your daily anti-inflammatory support. The fifth ingredient is lemon, specifically fresh lemon juice. Lemon is extremely high in vitamin C, and vitamin C plays a crucial role in maintaining the structural integrity of blood vessel walls. Healthy vessel walls are smooth and flexible, which allows blood to move through them efficiently. Vitamin C is also involved in the biological processes that support nitric oxide production, so it serves as a supporting ingredient that amplifies the nitric oxide benefits of both the beetroot and the pomegranate. 1 teaspoon of fresh lemon juice is all you need, and it also brightens the flavor of the drink considerably, making it genuinely pleasant to consume. To prepare this drink, you simply blend together half a cup of beetroot juice or chopped beets, 1 tablespoon of pomegranate juice or seeds, 1 teaspoon of freshly grated ginger, half a teaspoon of turmeric powder, 1 teaspoon of fresh lemon juice, and half a cup of water or coconut water if you prefer a slightly sweeter base. Blend everything together until smooth. You can drink it exactly as it is as a smoothie, or strain it through a fine mesh if you prefer a pure juice texture. Either way, the active compounds remain intact and effective. The best time to drink this is first thing in the morning on an empty stomach. When your stomach is empty, the compounds in this drink are absorbed into the bloodstream much more rapidly and efficiently than they would be after a meal. Drink 1 full glass, and then wait approximately 20 to 30 minutes before eating breakfast. That window allows the nitrates from the beets, the gingerols, the polyphenols from the pomegranate, and the curcumin from the turmeric to begin circulating through your system before food enters and potentially slows absorption. Now, I want to tell you about something that takes this entire protocol to a significantly higher level of effectiveness, because the drink alone is powerful. But when you combine it with a specific 5 to 10 minute activity immediately after drinking, the effect on your nitric oxide levels and your overall circulation is dramatically amplified. Here is why. Physical movement, even very gentle movement, stimulates the blood vessel walls in a way that triggers additional nitric oxide production. The vessels respond to the mechanical sensation of blood moving through them by producing more of this circulation-boosting molecule. So if you drink your circulation beverage and then immediately engage in light movement, you are combining the dietary nitric oxide boost from the drink with the mechanical nitric oxide stimulus from movement. The result is considerably greater than either approach alone. The activity does not need to be strenuous. I cannot emphasize this enough. We are not talking about a workout. We are talking about gentle, accessible movement that any senior can do regardless of fitness level. Gentle squats while holding the back of a chair for support, marching in place with comfortable, easy steps, light jogging in place if that feels comfortable, arm circles to get blood moving through the upper body, leg swings while holding a wall for balance. Any of these movements done for 5 to 10 minutes immediately after drinking will meaningfully enhance the circulation-boosting effect of the drink. Many of my patients report that within 15 to 20 minutes of completing this routine, they begin to notice warmth returning to their hands and feet. That warmth is real. It is measurable. It is the blood beginning to move more freely through vessels that have been given the signal through both the drink and the movement to open wider. Before I close, I want to make sure I address some important safety considerations because I believe in being fully transparent with my patients and with you. If you are currently taking blood thinners, please speak with your doctor before starting this routine. Both ginger and turmeric have mild, natural blood thinning properties, and combining them with prescription blood thinners without medical guidance is something I would not recommend. If you have a history of kidney stones, be aware that beets contain oxalates, which can contribute to certain types of stones in people who are susceptible. Again, a quick conversation with your doctor will clarify whether this is a concern for your specific situation. If you are on blood pressure medication, monitor your pressure as you begin this routine, because improving circulation naturally can lower blood pressure, and you want to make sure your medication dose remains appropriate as your health improves. I also always advise starting with half the recipe for the first few days. Give your body a chance to adjust to these new compounds before going to the full amount. This is not because the ingredients are in any way dangerous at the stated amounts, but simply because introducing any new routine gradually tends to produce better tolerance and better long-term adherence. The action plan I want you to take away from today is straightforward. Gather your fresh ingredients this week. Prepare the drink each morning before anything else. Drink it on an empty stomach, and then spend 5 to 10 minutes doing gentle movement. Follow this routine consistently for at least 2 full weeks before drawing conclusions about how it is affecting you. And as you go, pay attention to specific things. Is the coldness in your hands and feet improving? Is the swelling in your ankles less noticeable by evening? Are you sleeping more comfortably without that restless, uncomfortable sensation in your legs? Are you able to walk further before experiencing cramping? These are the markers of real, meaningful improvement in your circulation, and they are the things I want you to track. I have watched this simple, natural routine genuinely change the daily lives of people who had accepted poor circulation as their permanent reality. The research behind each ingredient is solid. The mechanism is clear. The results, when the routine is followed consistently, are real. Your circulation does not have to continue declining. Better blood flow means better protection against the serious consequences of poor circulation, including clots, stroke, and the loss of mobility that can follow. It means warmer hands and feet. It means less swelling. It means legs that cooperate when you need them to. It means more of the independence and comfort that you deserve to experience every single day. Try this for 2 weeks, notice what changes, and share your experience in the comments below. And if you know someone over 60 who has been struggling with cold extremities, swelling, or leg pain, please share this with them today. This is the kind of information that can make a real difference in a real person's life.